So my name's Caitlin, Dr. Caitlin Van de Kapel. I'm currently a locum anesthesiologist, or I'm on my way to staff here in the Department of Anesthesia at McMaster. I did my 5 years of anesthesia residency here at McMaster, and prior to that, I did my medical school at Western. One of the benefits to doing residency programs here at McMaster is that a lot of the programs have the possibilities of doing international electives or partnerships already in place. And as a PGY3, typically with the anesthesia department, you're able to go to Uganda for a 1-month elective. There it's both an educational and a clinical elective, so you're able to participate in the current teachings that are already ongoing within their Department of Anesthesia, and also participate in active teaching, as well as performing anesthetics on a daily basis. Most of the highlights included like not only just having coffee or going out for dinner with those residents, but also participating in their rounds. So they, like us, had standard academic rounds and also did journal clubs when they were reading the exact same journals that we were reading, and being able to talk about that on a very peer equal level. That was something that I took away as one of the more positive experiences. But what I was really excited about was seeing the ingenuity of the practitioners. So they were able to achieve the same clinical outcomes and have the same goals and the same hopes for their patients that I would within a different environment and a different practice setting. So I was able to use things that we wouldn't necessarily use here on a regular basis, like different pharmacology. So the use of ketamine as a sole-based anesthetic is not something that I would necessarily do here in Canada that I was able to see in Uganda. The use of T-pieces on their anesthetic machines for a lot of pediatric cases is not something that we would regularly do. And the use of regional anesthesia in place of general anesthesia for a lot of the cases that we wouldn't even consider doing that for, I think shows the breadth of the anesthesia knowledge and the anesthesia capacity in those situations and those countries. The biggest shock to me when you come is that you hear that there's only 40 some odd anesthesiologists in Uganda for millions and millions of people. And that conceptually is something that you don't understand until you're there. They're always on call. They're always working. They're always putting their families, their personal lives at bay to provide anesthetic care the best that they can. Typically, patients would show up in the morning and wait all day, potentially, to be seen by a clinical practitioner, whether that be a nurse or a doctor, for a seemingly odd number of specialties. And some days those patients would not be seen, and they would go home at the end of the day, having spent the entire day sitting outside waiting, not being seen, to show up again tomorrow for yet another quote-unquote queue. And I think that that surprised me the most, that I physically saw the shortage that occurred. But until I saw that, I don't think I actually understood what they were dealing with. And so that, to me, was a completely humble experience. And I think that's what shocked me, surprised me the most. So I think if you're interested in an elective and you know that it's going to be an international elective, and you're wondering how can I best prepare myself to be leaving my current educational situation, ensuring that I'm meeting my educational goals, ensuring that I'm creating a reciprocal relationship with the host country, I think you need to first start with the concept of reflection. I think it's very important that you understand your current motivations and the motivations that are surrounded within the partnership. I think it's important to understand that any elective is not just one-sided, and that you as the learner need to obviously gain from going there, and you will, I think, just inherently by being there. But you need to understand, why are you going? What is your goal for going? And what can I give back when I go? I think you should have a good understanding of the country that you're going to, both from what you need to pack, also to what the current situation is in regards to the healthcare provision that you're going to be partaking in. And then I think the most beneficial thing that you could possibly do is contacting the host country that you're going to, the contact that you've either been given or the department that you're going to be working with, and asking them, what, as a trainee coming to your environment, am I able to give? What is expected of me? What kinds of things can I bring with me? Sometimes you'll be able to provide PDFs of your current textbooks to the residents. Sometimes you'll be able to provide educational opportunities. Like maybe you'll be discussing ACLS with them if that's what you happen to know. Maybe you can provide presentations or partake in their journal clubs. And I think if you're able to discuss that with them up front, you'll be more apt to actually participate in those when you go. And then I was able to contact my mentor over in Uganda and start an open dialogue with him, as well as create contacts within the residents, so that when I got there, I already had a semblance of who those people are, and I could start to create stronger friendships that would be beneficial, seeing as the time period that you're actually physically in the country is so short. And in my opinion, the hope would be that you would continue that partnership afterwards. I think creating those contacts is probably the most beneficial